Good afternoon, everyone, and thank you for attending Office Practicum's Lunch and Learn today. We are very excited to show you some of Office Practicum's time-saving tips that can help conquer back to school chaos. Before we get started, I want to let you know that we will have a Q&A session at the end of this presentation. However, feel free to ask any questions throughout the presentation. In your GoToMeeting, there is a question box. If you guys go ahead and put in your questions there now, and we'll certainly give you some time after the presentation. Time permitted, our goal is to answer as many questions asked today. Okay, let's move forward. Speakers today. First of all, my name is Brett Cleary. I've been with Office Practicum for about 8 years now. In total, I've been in the EHR pediatric space for about 23 years. My colleague is Susan Hannon. Susan is a senior sales engineer. Susan helps work with our sales team, our product team. Prior to Susan moving into this role, she's had roles as an OP sales trainer. She has actually worked in direct sales as well. And prior to her coming over to Office Practicum, Susan actually worked as a biller for an existing OP practice. So Susan is our Wikipedia, and we're glad she's on this meeting today. Let's go to the objectives. Our objectives today. Well, first of all, we want to show you guys how to fill your schedules with back-to-school visits throughout the summer. We want to be able to identify specific patient groups for recalls by age, vaccine status, or zip code. Manage vaccine forecast inventory. We know that's something that you guys probably do year-round. Obviously, it's a little critical this time of year with more patients consuming vaccines, but that's obviously something we want to highlight today. Complete school and camp and sports forms in seconds. That's incredibly important for saving time, and we certainly want to dive into that as well. And then learn patient engagement strategies for better communications with your families. And finally, eliminate the administrative burdens for your staff. Now, as far as the objectives, I know we have some OP clients that are on this Lunch and Learn today. Thank you for attending. This might serve as a refresher for some of you guys, just to have you some tips as far as what you guys can use for the back to school season. Maybe you have some new employees that want to look at as far as what we have to offer. And for the people that are not OP clients, again, thank you for attending as well. And these might be some good tips or suggestions for your current EHR contingent they can offer them. If they don't offer them, maybe you might want to ask them, as far as if that's coming, if that's available. Or if you want to actually learn more about it with OP, we'd be happy to show you more in detail. So let's go ahead and begin with it. It all starts with a smart planning. Where to start? What's our game plan, right? So where to start? And there's a couple of groups that I think are very important when you talk about back to school. So one of them is identifying rising kindergartners. As many of you know on this call, Dr. Sue Cressley was our medical director. Now she's the AEP president-elect. And I remember years ago when I first started, she did a meeting with a lot of the sales reps, and she always emphasized trying to identify the rising kindergartners. She thought there was an importance having those people scheduled at the beginning of the summer to give them ample time to come in, ask the questions, perhaps a big step, obviously going to kindergarten for the patient and the parent, and making sure that they have that better experience as opposed to maybe the last week before school when things are very busy for you guys. So that's very important. Seasonal sports physicals, trying to identify those kids, those 14 to 18-year-olds that are going to be playing football, lacrosse, soccer, finding those folks as well. And then school mandated vaccines, for us to be able to pinpoint those children that might have immunization gaps that need to be addressed before the start of the school. And I think for the most part, if we can focus our attention on these groups, we believe, obviously, as you can see here, filling in those gaps in your summer schedule, that should lead to increased revenue. But it also helps with balancing your schedule. So being able to put some of those kids that might have just rushed into your practice the last 2 weeks, and now maybe they're actually in June and not maybe the end of July or August, depending on where you live. So let's take a look at the next slide. And what we want to do to start off with, and we need your participation. It's a polling question. And And the question is, how do you find all the 4 and 5-year-olds in your practice who need back to school physicals or immunizations? And your choices are: we run reports, we pull charts, we keep a spreadsheet, or we wait for them to call us. So let me give it about 20 seconds. You guys go ahead and vote, and then we'll take a quick peek at the results, and I may have a couple comments on that. All righty, just another couple more seconds. Make your selection, and we'll look at those results here whenever they're ready. And for our moderators, if you have those results, go ahead and bring those up. All righty. All right. Oh, there we go. Thank you. Okay, let's see what we got. We run a report. That's great. That tells me we have a lot of OP clients looking for those 4 or 5-year-olds. I'm happy to hear that. We pull charts. That's okay. That probably tells us that really we probably have some paper practices on this meeting, and then certainly I understand the reason why you'd have to pull charts in that scenario. We have a spreadsheet, understandable. We wait for them to call us. Yeah, 7%, a little surprising. And certainly, I mean, that's kind of the goal today, is to try to get proactive, right? We want to be able to, instead of them having to call us, we want to be able to reach out to them and let them know that their child may need to come in for whether it's immunization or a physical. So all good results, very interesting, but I am glad to see that you guys do run a report at this point. So let's move on. And we'll kind of focus on the patient recalls and messaging. So really the goal for us is to create a report and a parent list, if you want to call it a campaign, in just a couple of clicks. So again, as we mentioned earlier, you want to focus on age, right? You want the 4s and 5-year-olds. You want the 14 through 18-year-olds. You want those kids, because those are probably targeted kids that probably are going to need services during this back to school season. By zip code, as you can see, we put stagger by school start date. Perhaps your practice has a larger footprint, right? Maybe you serve a couple different school districts, right? So you want to start with those schools that start sooner versus the ones that are later. And we can do that with OP, looking for those kids that actually fall into those zip codes. And then obviously by vaccine status as well. Obviously, you want to be able to identify kids who are due for well visits and vaccines. Those kind of go hand in hand. A lot of times, especially with the younger kids, if they're due for a well visit, they're probably overdue for vaccines. So we certainly we get that. The nice thing about office practicum, when we're talking about well visits, you can actually every kid is actually enrolled in a plan that identifies when they are due for a well visit. It's based on the AAP periodicity schedule. So it's just not the annuals. It's the kids that are 30 months and the kids that even the younger kids. But we can actually run these reports to find those kids that are overdue for those well visits. Let's move on. So really, if you think about it, with patient recalls and messaging, it's almost it's an equation, right? You've got to find the kids, and we're finding the kids in OP. We're finding the kindergartners, we're finding the teenagers, and so we're identifying those kids, and we bring up this report. And really the second part of the equation is now we've got to message those kids. And so that's the nice thing about office practicum. The people that are office practicum clients know this. We use what's called patient message exchange. We call it PMX for short. It's built into office practicum. And it allows you to create a message intended for that group of kids or their parents. And then you guys put in the call to action. So based on the communication preference, it could be an email, it could be a phone call. Obviously the most popular is text. You're creating that messaging, and then you're going ahead and you're blasting that out, and hopefully they're going to do the call to action, whether it's to call the practice, to schedule an appointment, or maybe even go to the patient portal to self-schedule. So with that, obviously that kind of piggybacks on the automated reminders. We can do that. So once they made the appointment, obviously we can actually remind them that they have an upcoming appointment and maybe some call to action items that we want them to do before they actually come into practice. So let me turn it over to Susan, because I want Susan to actually show you what I've been talking about the last couple of minutes. And Susan, let me pass the baton over to you.
Okay. Going
All right,
to,
that looks good, Susan.
all right. So in OP, that demographic analysis and recall, the ability to look at your population of kiddos based on your needs. So I'm just putting no date restrictions and put my active patients. As a reminder for our OP customers, you can show future appointments and even exclude those kids with future appointments. But in this respect, what Brett was talking about is we have the ability to also feature that, to filter this. So do I want my kiddos that are just my kindergarteners? Do I want my kiddos that are just kindergarteners and maybe are in one of my locations, because those locations are specific to different school districts? Or do I have a newer provider that I want to fill their schedule, right? So when you think about these recalls, there are a lot of strategic ways to look at it. And in this case, we're really just going to look at those, again, those kindergarteners. But just reminder, we have all sorts of features in there. Now, we recall based on care plans, and all kiddos in OP are registered in a care plan called Bright Futures. In essence, as Brett said, it's the periodicity table. And in this case, we're just going to recall those kids that are due for a well visit. And let's say, they're due for a well visit as of June 15th. And then literally OP is going to go through and analyze each of these kiddos and determine who is due for a visit. And I'm just going to stop this just so we can kind of see results. And so from here, this is where you see all of the kiddos, and I can now send that message. Your kiddo is due for preventative care. Your kiddo is due for whatever those elements or items are, and it's that simple to get those kiddos in. Now, the second part of the vaccines. So as a reminder, you may have kids that got their well visit. They may not be due for a vaccine right at they may not be due for a well visit, but we know that they have to have certain vaccines within whatever the school district requirements are. And this is also used quite a bit as a reminder, unfortunately, when we do have epidemics, right? A measles epidemic someplace. And now I'm just going to search for all of those kiddos that need, in this case, an MMR. OP's forecast, vaccine forecast, which we'll see in a moment, goes through, and it is actually the CDC or ACIP schedule built in, individually forecasting per child. So it's going to go through and analyze all of these kiddos that need that vaccine, and it is going to then give us all of those kids that are due, or even, as you can see here, some of our kids are behind. And again, the ability to send a message to bring these kiddos back into the office is great to fill your schedule, and it's also really great medical care. With that, Brett, I'm going to send it back over to you.
All right. Yeah, just to put an exclamation point on what Susan was saying, I think it's important. Really being able to isolate what you want your parameters to be. So, and Susan had mentioned this, but let's say you want to have Dr. Kramer. We want to know all Dr. Kramer's kiddos that are overdue for a well visit. And I think maybe even that for maybe if you have a new provider, right? And if you want to balance their schedule. So it's definitely some helpful tips there. Let's talk about immunizations. So maybe the game plan has worked. We've got the kids in the practice, right? You're about to see them. So when you're seeing each patient's vaccine forecast, we want to have that good visibility, whether it's the nurse, whether it's the provider, saying exactly, okay, what does this child need? What are they due for? What are they overdue for? This is violating any spacing or any age rules. Having that visibility is important. As Susan will show you here in a second, maybe doing a call out to your vaccine registry. Maybe it's a new patient, things like that. That's all very important when you're talking about immunizations. Maintaining real-time inventory as vaccines are administered. So the doctor or the nurse practitioner is about to give that vaccine, being able to say, okay, I know this patient is a commercial pay or a private pay patient. I'm looking at DTaps, okay, and I know that I have enough vaccine back in the fridge to go ahead and order with confidence. So doing that. The second bullet point, plan your vaccine order around school mandated vaccines. Yeah, it's one of those things where, and Susan will articulate this when I turn it back over to her, but being able, and that probably starts now, right? Being able to look at your forecast to say, okay, how much vaccines do I have now? What does it look like in the next 30, 60, 90 days? So OP has a very good vaccine forecast model that will predict what you need to to order, because the reality is, we know that vaccines for many of the practices, especially with those commercial payers, that's expense number 2 behind payroll. So what we want to make sure is we want to make sure you don't over order, because you don't want to actually have vaccines that eventually expire and then you have to eat those costs. But we don't want to under order where you have to tell mom or dad, yeah, I need you to come back next week. They don't want to do that, right? So just getting that right is very helpful. So Susan, if you could help me out here and show some a little bit more about OP immunizations, that would be great.
Absolutely. And we're all set?
Yep.
All right. So when we think about OP, a couple things. Here is my kiddo. So starting with that vaccine forecast, as those of you who are OP customers know, we put this everywhere. We believe all of our staff, our front desk, our clinical staff, our providers should all have access, because we know parents ask the question of all of us. So the first place we're going to look at is we're going to look at our kiddos chart. So I'm in Paisley's chart here. And when I go down to my immunizations, you're going to see it's red because my kiddo is overdue or due for vaccines. When I open it up, these are the vaccines that they are due, or as you can see here on my DTaP behind on. As I hover over them, it's telling me the why, right? And the range within which we can give it. Now, you may have kids that join your practice from someplace else within your state. We have 48 immunization registries across the country that are either state or locale specific. Most of them now, have gone to the highest technology that's out there, which is bidirectional. So we're really excited about that, because what that means is that now you can sync to the registry. So I'm located here in Pennsylvania. If a kiddo comes to my practice from Pittsburgh and I'm in Philadelphia, I can then download all of those vaccines. And now this forecast is going to have all the vaccines for our kiddo so that we don't have to manually enter them. The second place we look at the immunizations is really within the well visit itself. So now I'm in my 4-year-old template, and we're going to go down to that plan and order. So now I'm a provider, and I am looking at my immunization order sheet. Now, here are the vaccines that I regularly give within this visit. As you can see, I have that same forecast down the bottom. Again, we have it everywhere. If I'm somebody who would like to open up the immunization chart itself, absolutely, you can do it right from the same order sheet. Now, Brett mentioned that we actually have our vaccine counts. So right now in my fridge here for my Daptocel, I have 100 VFC and I have 99 private. And so when I go to administer these vaccines, I know in real time I can order with confidence that I have what I need available. Just as a hint, here down here in the bottom is my kiddo's VFC status. So Paisley here is a non-VFC patient. Now I already have things pre-ordered or pre-bubbled. They're not actually ordered based on what I commonly give at this age, and they're still bubbled because my kiddo actually is due for them. But if mom decides she doesn't want all of those vaccines today, on the fly we can make those changes. And now my provider is going to be able to create this order. Now, in reality, this order not only is sitting on our visit, but it actually has gone out to our nurses at our nurses station. When our nurses go and administer these vaccines, they simply are going to select their Daptocel. Now, it is only showing the lot that matches the VFC or private status of my kiddo. Our nurses is going to then say what body site. And what is happening here is it is actually putting it in today's visit. It's putting in their immunization record. It's sending it out to the immunization registry. It's actually putting it in school forms, which we're going to talk about, and it's creating all of those charges. And it's faster to do it than it is actually to say all of those items. Now, the other part of this is how do we look at our kiddos, and we looked at that demographic analysis and recall, right? We know what our population of kiddos is, but how do we look at what our forecast would be based on what's on hand? So when I look at here are my vaccines that I have in my office, meaning these are the ones in my fridge in this moment. And so these are the months that I give my vaccines. And I'm really good at getting about 100% of my kiddos at these ages to get their vaccines. Here's what I have on hand for private stock. Here's what I have on hand for my VFC. And then these are the number of kiddos that match one of these months over the next 3 months. So when we have that ability to order, absolutely. Now we know that maybe we don't have all our parents are really good at doing our vaccines at the months we would like them to be. So you can actually change your percentage uptake. And now this would be 60% of the kiddos that are going to be those ages, right, are based on our demographics. And it allows you to then really make strategic decisions. For those of you who may be multi-location, just know you can do this for all locations, or if you do that centralized scheduling, a centralized ordering, or you can do it for a single location as well. And then just that last part, when we really think about the inventory piece of it, here is that inventory. So as we go and look at our vaccines, if you remember, I had 99 vaccines available. We just administered one. Now we're down to 98. This is a real-time inventory management system. And if you put in your cost for those private versus my VFCs obviously don't have a value to them, a monetary value, I didn't buy them. This is going to tell you in real time how much money you have tied up in your fridge. So if you think of being able to analyze your demographics and then being able to look at those demographics and who's going to need what over the next 3 months, and then looking at what I have here, now we can order in a strategic way so as not to tie our money up in our vaccines. And with that, Brett, back over to you.
Yeah, that's great, Susan. Yeah, thanks very much. All righty. Let me see. Okay, let's do another polling question. There's only two. We're not going to poll you to death here. And for those that are not providers, if you want to guesstimate what you think it takes your clinical team, the question is, how quickly can you complete a school, camp, or athletic participation form? Your choices are under 5 minutes, between 5 and 10 minutes, 10 to 20 minutes, half an hour. We asked the parents to come back in a couple days, 2 or 3 days. If you guys can just take the time to vote here, and then we'll look at the results and see what they look like. And let's see those results. They should be coming up here in these. Oh, there we go. Okay. I'm a little surprised about we asked the parents to come back in 2 or 3 days. Let's talk about the first one though, under 5 minutes. That's great. So we got about 40%, over 40% that do under 5 minutes. The one thing I'll mention, whether it's the 5 minutes or the 5 to 10 minutes, think about this. Let's say it takes your provider 2 or 3, let's say it takes 3 minutes, right? 3 minutes, right? If they see, I don't know, 7 well visits a day, sometimes 3, 21. So what could they do with the extra 20 minutes? Could they see an extra patient? And that's kind of the way my brain works as far as, does it give the provider a little bit more breathing room during this crazy time, just having those extra minutes? So kind of think about that too. The other thing to think about also is, yes, you're probably going to go ahead and fill out this form. You're probably going to give it to mom and dad. Out they go, right? But what if they lose it, right? If they lose it, and some might get some prices will probably charge for that that form. I get that, but you're having to do it over again, right? So not having to have to do that is very important. Asking parents to come back in 2 or 3 days, it's a bold strategy, right? Because parents they want to come to your office, get that well visit done, get their handouts, their forms, and be done with it. So OP actually will avoid you doing that, having them to come back 2 or 3 days, because you can print it within seconds. And again, Susan will show you that here quickly. But anyways, good results there. Good, interesting answer. So let's keep moving forward. So school forms. One of the biggest things in office practicum is having over 200 plus state and local forms for camp, school camp and athletic participant activities. They're built in for our OP clients. If you're ever curious which ones do you have, they're listed on the OP Help Center. number one. Number two, if you just say, hey, let me reach out to my account manager, they will know if we have that included with OP. We also do custom built forms. I think that's very good for maybe you have a school district that's a little bit different than the rest of the state. Maybe you have a private school that a lot of your patients attend that OP hasn't built yet. Or maybe perhaps it's a popular camp that all your kids go to in the summertime. Those custom built forms, OP can do those, right? Create those. And again, if you have some custom built forms, you're an OP client, you may want to talk to your account manager about that. But the best thing obviously is being able to complete it with just a couple of clicks. I think that's the most important thing. So don't believe me, I'm going to have Susan show you what it looks like. So Susan, can you show the school forms, please?
Absolutely.
All right, looks good.
All right, so this is the shortest demo you're going to see. So right within Office Practicum, here's my school and camp form. Here's my kiddo, Paisley. She's at the end of her visit. Maybe your front desk or your nurses will do this. We have a generic form, but as Brett mentioned, we also have forms that are loaded. Now, notice that I'm going to I can share to portal, right? This is a demo site, but I can print this for mom and simultaneously share it to the portal, which means when it's lost, you don't have to redo it. And now here is your entire form. Here's my visit for today's date. Here are all the vitals, all the information. And if you remember, we did Adaptocel and we did a ProQuad. So my ProQuad is that MMR and varicella. It completed it specific to how this form needed it. My hearing vision, all of my vitals, my provider signature, practice information. By the way, this is Office Practicum's home address, and you're done. So as simple as that, as many forms as you need, OP is happy to load into your system.
Yep, and Susan showing how quick that is. That's the idea. That's the speed. So thank you, Susan. Let's talk about patient engagement tools with some of the time we have left remaining. When you think about patient engagement, most people just kind of default to patient portal, which is true. It's a little bit wider than that. So with OP, you have the ability to send automated appointment reminders to reduce the no-shows. So again, like I mentioned earlier, with patient message exchange is built into OP, you send out it based on the communication preference to the caregiver. They can self-confirm. The one thing I'll mention on this, just so you guys know, as far as some of the intelligence behind Office Practicum. So let's say, for example, you have an 18-month well checkup. Send out that reminder, parents confirmed. They're going to get a second text message right after that. It's going to actually tell them to go to the patient portal because we need them to fill out a survey. In this case, maybe an MChat, being an 18-month visit, excuse me. So OP will do that for you because we're trying to drive patients to the portal to do that work before they get into your office. The portal is your friend. I heard this from a customer recently at our users conference. The portal is your friend. It is a utility player, except you don't have to pay them benefits and a salary. It does a lot for you. And part of the name of the game is really trying to get those parents to engage with that. The goal, if you can get more parents on that, it's going to reduce your calls. It's going to help your front desk staff. It's going to allow you to do patient messaging in the portal. It's going to do those things such as minimize administrative tasks. Those health forms, for example, what Susan just showed you, those can be sent to the portal. We can have some that are automatically that can be sent to the portal. The growth charts are automatically there. The patient handouts, the exit notes, those will go directly to the patient portal. So if you can drive the parents to the portal, they're going to see the value of the portal, which is going to will help you guys out a lot as far as reducing some of those calls back to the practice. Last thing I'll mention is scheduling. It's important. Self-scheduling is an Office Practicum. It's in our patient portal. I will say this with scheduling. I know a lot of people are fearful about giving your parents the ability to self-schedule. Start with a flu clinic, right? Start with a flu clinic. Blast that message out to all your patients or your parents. Tell them that you have the ability to do self-scheduling for the flu clinic. If that goes well, maybe think about doing well visits, right? Open up to well visits and see how that goes. But those patient engagement tools will certainly help a lot of your staff not have to take as many calls when a lot of that stuff can be actually found in the patient portal. Next slide, Paige. All right. So audience questions and answers. So submit your questions right now in the question box. And I will see if we have any questions already. You can do that now. Let me see from one of our moderators if we have any questions that have already been asked during the presentation.
Hi, Brett. Yes, thank you to you and Susan for sharing your expertise today. You had some really great insights on the back to school planning. And we did actually have some questions from the audience. So
good.
first question is, how can I get a specific school or activity form for my practice?
Yeah, I can field that one, Susan. Two ways. Number one, as I might have mentioned, I would reach out to your account manager. Obviously, you can go to the OP Help Center, but as far as the up-to-date school and camp reports, reach out to your account manager if you're an OP client. Number one. Number two, if you're not an OP client and if you're curious, there will be a survey after this. Let us know if you're curious about school and camp forms. We'll let you know if we have them. If you want to have extended conversations about OP in general, we can certainly do that as well.
In addition to that, when you do reach out to your account manager, my suggestion is email the PDF of the form so they can match it to your specific one, because forms sometimes have very similar names. So knowing exactly which form it is and sending that PDF will really expedite that request for you.
Yep.
Thank you. The next question is, do I have to do anything differently with VFC versus private stock when I add it to my inventory?
Yes. So, but it's a checkbox or a radio button in OP. When I'm adding that inventory in, you're just going to bubble it's VFC or it's not VFC. And really the key to that is all this information automatically goes to your immunization registry, right? So we need the information to be correct. A lot of immunization registries are also tracking those VFC vaccines that are administered, but you do need to have the private lot and the VFC lot separate so that you know which one you're pulling from. Your nurses get the correct one. It's all interconnected, but it's incredibly easy to do.
Thank you, Susan. The next question is, and you may have covered this, is there a way to include a signature on the school form?
Yes, absolutely. So I did have a signature on my school form that I showed. This is part of, for our OP customers, just as a reminder, if you've loaded your provider's signatures in, they will automatically map to the school form. It's something we'll do for new forms as well. For those folks, this is really just a key piece of OP because we're sending it electronically. We need that signature in, and it's that simple. If we had to print it and sign it, takes longer. Now, we do know there are occasional forms. Pennsylvania is one of them. We have a couple that are ink signature required by law. That's fine. That's one of those things. But probably 95% of the forms we have across the country are the electronic signature is acceptable.
Perfect. Thanks, Susan. And this is our last question. The question is, can the vaccine form be a certified form, which is a requirement for Florida schools? We have to go to Florida Shot's website and print from there.
So I know we have some states we have specific like the certified forms we have a lot of Florida practices. We can definitely take a look at that. I do not 50 states. I apologize. I don't know off the top of my head, but I know we do have some states where those specific forms are ones we can automatically print from OP. A lot of time it's the state requirement that we have to look into. Does the state require it printed from their site, or will they allow us to load it in so that we can print it from ours? But we can definitely look at that.
Wonderful, thank you. And we did get actually several questions around, is the webinar going to be available after today? And the question is, yes, we will be sending this out to everybody who has attended and registered for the webinar. So Brett, I'm gonna turn it back to you to wrap everything up.
Yeah, so let's look at the resources. And selfishly, I'll tell you which ones I like the best. The videos. I'm kind of a video guy. That's how I like to learn and process things. That first video under videos, it says webinar, the power of patient recall. So if you like what Susan was showing about being able to actually find patients that are due for recalls, it could be already ADHD or med checks, or maybe our asthmatic patients. That's a fantastic video. Client success stories, the second one down, from insights to impact. I love that one. The power of data and patient care and practice growth. It's a larger OP practice that really embraced doing these recalls, struck the balance of quality of care that they're offering, obviously increasing revenue, kind of a win-win there. So that's a really good one. And selfishly, excuse me, bonus content on the right hand, compare us. I love to send this to practices that are not using OP, saying, take a look at this, all these pediatrics features, compare it to what you're using now, and that really kind of helps separate us from being a pediatric specific EHR to maybe some of the other vendors out there. The last thing I want to mention, you can actually push forward to the last slide. I want to thank you for joining the webinar today. There is a survey for you guys to fill out. Please fill out the survey. We want to know what we did right, want to know what we can improve on. Please be very candid on that survey. For those folks that are not OP clients, certainly we welcome the opportunity to have a conversation with you about our solution to see if OP in your practice would be a good fit. There's an option for you to have somebody contact you, an OP representative contact you. Please check out that box. With that said, I want to thank you guys for joining the webinar and have a great rest of the week. Thanks, everybody.
Thank you.